Well, welcome to the 27 lovely colleagues who have joined us today for our quarterly lunchtime webinar. My name's Ailsa Rutter. I'm the director of the Fresh and Balanced programme here in the northeast of England, and we're really delighted with the momentum gaining around these lunchtime webinars. They're joint between Fresh, the Regional Tobacco Control programme, and our ICB Smoke-Free NHS programme. And I think it's really important that we're doing these together, because really all of the work across the northeast has been a joint effort, everybody's business, everybody working together, whether it's Fresh with our fantastic LA colleagues, our NHS partners, voluntary sector, many others, including national partners, international partners. And I think it's just nice that we can show that, making smoking history is everyone's business. So the webinar today, we're doing these every quarter. And today's one, if I can move my slide now, Joanna, my slide is stuck already, even though I'm pressing it on my laptop. That's just great, isn't it? There you go. So apologies for my slide sticking. So just when I was talking about making smoking history is everyone's business, I think many of you who have dialed in today will be really familiar about this slide, but we think this is still the most powerful slide that we can really encapsulate why we've got this webinar today, but really importantly, why we've got such a collective kind of partnership approach across the region, is because probably everybody who's dialed in today would be sadly able to provide a photograph of one of their loved ones who sadly his life was taken nearly always way too soon because of tobacco, because of particularly combustible tobacco products, lethal combustible tobacco products. And in fact, it's 26% of all deaths in the last 50 years due to this. So nearly 8 million lives just in the UK. And top left, I would like to pay tribute to my dad, who will have died 24 years ago on the 23rd of December, who took up and got addicted to smoking when he was 11. So I think this is what really, hits home, particularly in the northeast, where traditionally we had much higher smoking rates, as to why, we've had enough of this, and why absolutely we're committed to taking that whole system approach to ultimately, ending something that is completely avoidable, which is, deaths from tobacco smoking. So for those of you who might not be as familiar with the work of Fresh and Balanced, this is our partner website here. You can find out a lot more around the 8 key strand approach that we take in terms of reducing smoking across the region, and in triggering more quits, in helping people to quit smoking, really importantly to reduce uptake of smoking, but also to provide and protect people from tobacco related harm. And these multiple strands, these 8 key strands, are very much based on international evidence, but we're really proud in our region through 20 years now of our collective effort that we've established that these have had a really positive impact. There isn't one magic solution. You have to do lots of things simultaneously. And to find out more around, those strands and how they work together, you can go to the website. But also, really importantly, the role across all 12 of our localities all now have a tobacco alliance. So for any of you who aren't involved in your local tobacco alliance, we couldn't recommend enough to get involved with there, and the fantastic work that's being led by the tobacco control leads across the LAs in partnership with many others. What we're trying to do as well is, if you think about it, we're trying to have this system-wide approach to maximising quitting. Again, it needs to be very much recognising that the person who smokes is at the heart of a lot of our efforts. What we're trying to do is give people as many options to quit, as many routes to quit, that they can access support throughout the region. And there is some fantastic work going on between Fresh, between Smoke-Free NHS programme, and really importantly across our LAs and across our acute trusts and many others, to really think about how we can really further increase those annual quit attempts. And the reason why we're so focused on doing all of this is because we as a region have got a very clear vision for the future. We're very much looking at this from a health inequalities lens. There isn't a magic solution to all of this, and there is no room for complacency. But Dr. East might not know, but we are the only region actually that has got such a clear, bold vision, a declaration for an entirely smoke-free future. We very much are looking at the fact that this will have the biggest impact on our most disadvantaged communities. We have an interim target of 5% smoking by 2030, but ultimately, our goal is the Northeast to have zero tobacco smoking. We believe that it's the right thing to do. We know the public are backing us. We think it's the right thing economically as well. And I suppose that's why today's webinar is just so exceptionally timely, because we know there are barriers in our journey in terms of potentially, holding people back from potentially trying to quit smoking. And that's why the topic today is so important. But because of all of this joint working, etc., I am really pleased to say, and on the basis of the latest national prevalence figures, we've now seen all of us together working so hard, a 65% reduction in the Northeast around adult smoking. It is the biggest drop of anywhere in England, and I think it's something that we should be really proud of, that we can go from the highest smoking rates to now the second lowest. But we are not complacent. We know smoking rates remain way too high amongst key priority groups. We know there is so much more to be done, and we know that we really need to throw everything at this, I think, over the next 2-3 years in particular, and then really thinking through, what does 2040 look like? What are the key levers going to be for us to achieve this vision? And this vision is absolutely the right one to have. Smoking had a beginning, it's had a middle. We firmly believe it can have an end. So on that basis, today's topic actually is around filter fraud. And I'm absolutely delighted to welcome Dr. Kate East here, who's just phenomenal. She's just really doing some fantastic, fascinating research. She's Associate Professor down in Brighton and Sussex Medical School. She's also a visiting Senior Research Fellow at my old university. I'm very proud of my allegiance with King's College London and the fantastic team there as well. But it's brilliant Katie's given up her time today to prepare to come and share with us her huge expertise actually around cigarette filters and about why this needs to be such an important policy area for us, why filters are holding us back. And she's going to expose to you all this deadliest fraud in human civilization. So she'll explore some of the misperceptions of the health harms around this. And we'll also be touching upon kind of at the end of today's webinar, where we've got to in terms of influencing policy landscape, and in particular around the tobacco and vapes bill. So what we would really like is to let Katie do her presentation. We'll then upload this onto our local tobacco control group on K-Hub. We'll probably share this also on YouTube, as in Katie's presentation. During her presentation, if you please keep your microphone muted, but please absolutely know that there'll be plenty of time at the end to ask Q&A. Please use the chat function. Joanna and I will monitor that. You'll also, very importantly, have an opportunity at the end to provide feedback around today's webinar, give us suggestions for future topics, and please spread the word actually that we are, we're able to bring here global leaders actually in specific topic areas to share their expertise. So thank you very much for coming along. So I will stop my sharing and I will hand over to Katie. Thank you.
Thank you. Let's see if this works.
Yes, we can see.
Great, amazing, thank you. So yeah, thank you Ailsa and Joanna for inviting me to speak today, and thanks for that fantastic intro. So I've been asked to speak on the subject of cigarette filters and the rationale for banning them, and I'll also be talking about some of the work that we've recently done on misperceptions of cigarette filters as well. So this presentation is timely because we've recently published 2 editorials calling for policy action on cigarette filters. And as I'll go on to talk about later, it's also relevant to the tobacco and vapes bill, which is currently going through Parliament. So the first paper on the left was led by myself in collaboration with colleagues at ASH and King's College London. And the paper on the right was led by Dr. Shannon Gravely at the University of Waterloo in Canada. And there's strong international support for a filter ban. So the paper on the right was written under the International Society for Research on Nicotine and Tobacco. We had a lot of authors from different countries all calling for a filter ban. So this presentation is structured into 3 main parts. So first, I'll give an introduction to cigarette filters and their health and environmental risks. I'll then talk about opportunities for filter bans and policy recommendations. And then third, I'll talk about misperceptions of cigarette filters and how these can represent a barrier to implementation. So cigarette filters were created by tobacco companies and they falsely promoted them as reducing the harms from smoking for many years. So filtered cigarettes were subsequently followed by ventilated filters, which are also called light cigarettes, and you can see how the term light cigarettes would confer kind of reduced harm. However, claims that cigarettes with filters are lower risk were based on very early limited studies, often using machine measured approaches. So putting cigarettes into a machine and getting the machine to kind of puff on them. And these studies showed reductions in nicotine, tar, and toxicant yields. However, humans aren't machines. Humans engage in compensatory puffing behaviors to kind of get around the effects of filters. So these studies didn't consider the cigarette design and the way that humans actually behave. And for decades, the tobacco industry knowingly deceived the public about the safety of cigarette filters, and this is shown in lots of industry documents. So we now have a very established industry-independent body of evidence, which has shown that filters and filter ventilation doesn't reduce the toxicant exposure from smoking. On the other hand, filters increase the appeal and attractiveness of cigarettes. They increase palatability, so they make cigarettes taste better. They reduce the harshness of smoking, and they alter inhalation patterns. So people who smoke cigarettes with filters tend to inhale deeper and for longer, therefore exposing them to more toxicants. Cigarette filters also reduce the burn time, so the amount of time it takes to burn and consume the cigarette, which means that there's more time for the coal to smolder, and therefore this forms more toxic constituents. Cigarette filters also contain cellulose acetate fibers and microplastics, so people inhale these and then they get embedded into the lungs, and that also leads to harm. So in combination, these factors have meant that the introduction of filters have led to an increase in deadly lung adenocarcinoma. So this effect has been greatest among women. You can see on the right, the fat blue line shows the increase in adenocarcinoma relative to other forms of cancer. And this effect has been greatest among women, potentially because women started smoking later on than men and because filtered cigarettes were marketed towards women. And this is pretty robust epidemiological evidence that shows that filters have not protected people from the health harms of smoking over the years. So evidence reviews have found that there are two main ways that filters have increased lung adenocarcinoma. So the first is through changing the chemical composition. So as I mentioned, filters reduce the burn time. This results in longer combustion and increases carcinogens. And the second, as mentioned previously, filters lead to bigger puffs, deeper inhalation. So people are smoking more cigarettes a day. This smoke is going further into the lungs. And this is what's leading to increase in the specific type of lung cancer that's particularly deadly. And as I also mentioned, the filter fraud has been termed the deadliest fraud in the history of human civilization by a historian called Robert Proctor, who's written extensively on this topic. So in addition to health risks, cigarette filters are also among the largest global source of plastic waste. So filters are really harmful for the environment because they contain all of the chemicals and carcinogens that are in cigarette smoke, and these leach into the land when they're discarded. Cigarette cleanup campaigns are expensive and they're typically small scale, and they're largely ineffective just because of the sheer amount of cigarette filters that are dumped into the environment each day. It's just impossible to keep up with. So what are the opportunities available to help tackle the issue of cigarette filters? So fortunately, the World Health Organization's Framework Convention on Tobacco Control have recommended a ban on cigarette filters as part of their forward-looking measures on tobacco control. And these measures are based on the ground that banning cigarette filters would eliminate the false perception that filter cigarettes are safer, reduce plastic pollution, reduce the economic costs of cigarette litter cleanups, and reduce the environmental harm caused by toxic chemicals in discarded cigarette filters. And so this is, it's important from both a health and environmental perspective. And filter bans are also recommended in other countries. So two that are nearest to us are Belgium and the Netherlands. So Belgium's Superior Health Council has recommended a filter ban because they expect there would be a positive impact on the environment and an expected reduction in the number of people who smoke. And when we're considering policy implementation, it's always helpful to be able to look at a jurisdiction that has implemented a policy to kind of see if it's worked in the real world. So fortunately, Santa Cruz in California have announced a ban on filters in 2024, making it a world first. This includes a ban on filters in cigarettes and cigars, and a ban on filters made of any material, so including biodegradable filters. And we'll go on to why including biodegradable filters in a ban is important a bit later on. And this policy is set to be implemented on the 1st of January 2027. So it's really crucial for us to watch, see what happens in Santa Cruz, see what the industry come up with in terms of innovative products and loopholes, and any kind of impacts on the illicit market as well. So the UK Tobacco and Vapes Bill will also provide a unique opportunity to ban cigarette filters. So the bill is currently going through Parliament, but the hope is that royal assent will occur next year. And the bill will give government the power to regulate the components of tobacco products and tobacco devices. So there's potential for the government to use these powers following consultations to regulate cigarette filters. Because of the high levels of hand-rolled tobacco in England, any regulations would need to be comprehensive, so they need to cover like all filters that are separate from just manufactured cigarettes. And they should also cover all filters, including plastic and biodegradable. So for the final part of this presentation, I'll discuss misperceptions of cigarette filters and how these could represent a barrier to implementation. So first, I'll talk about data from the ASH 2025 survey, which was among adults over the age of 18. And these data are nationally representative of adults in Great Britain. So the ASH survey asked respondents, according to what you know or believe, to what extent, if at all, do cigarette filters protect smokers from health risks? And we know, based on the evidence base, that the correct answer is that filters offer no protection. However, unfortunately, only 1 in 4 adults, so 25%, correctly understand this. The remaining 75% we either incorrectly believe that filters offer no protection or were unsure. And among adults who currently smoke, accurate perceptions were lower, so only 17% accurately perceived that filters offer no protection from the health harms of smoking. So this isn't good news. It's important that the public are aware of the health harms of cigarette filters, and it would represent a clear barrier to policy implementation if the public weren't on board with it. So accurate perceptions are even lower in other surveys. So this slide shows work led by Dr. Shannon Gravely at the University of Waterloo, using data from the ITC 4-country project. And this is among adults who smoke at least monthly, age 18 or over, from England, Canada, the US, and Australia. And this question was asked slightly differently, but the key message is the same. Only 10% believe that removing the filter from a cigarette would not make it more harmful. And a massive 46% said that removing the filter would make the cigarette much more harmful, which we know is not true. And misperceptions aren't just limited to the general public. They're also prevalent among experts and policymakers. I mean, like prior to doing work on cigarette filters, I didn't even think that they might have anything to do with the harms of smoking. It wasn't until I started researching it that I actually knew anything about it. So Professor Jeff Fong at the University of Waterloo in Canada surveyed delegates from the Inc. 5 as part of the UN Treaty to End Plastic Pollution. And they found that 78% incorrectly believed that removing filters would make cigarettes more harmful. So, even among people who are making these policy decisions, misperceptions are very high. So why are misperceptions important? Well, they're important because they represent a barrier to implementation of a ban. Public support is really helpful for a ban to work effectively and to ensure compliance. Misperceptions among policymakers also obviously represent a key barrier, because why would politicians implement something if they don't think it will benefit public health? So there's a broad need to educate the public and policymakers about cigarette filters and their impacts. So how can misperceptions be addressed? I mean, a filter ban would obviously be the most favourable outcome, but it would also need to be accompanied with education campaigns and other avenues to educate the public about why exactly a filter ban is being implemented. Also, in the kind of run up to any filter ban or policy change in this regard, other policy options could help to correct misperceptions and bolster support from these more upstream regulations. So there's a vast amount of evidence from other areas of tobacco control that public education campaigns and packaging and labels can change people's perceptions of risk. So we could leverage these two options to help improve perceptions of cigarette filters. So public health education campaigns could highlight both the environmental and health harms of cigarette filters, and health warnings could also do this as well. So the picture on the right shows what the EU envisages additional labelling being. So at the bottom, it's got a little picture of a turtle and some plastic, and it says plastic in filter. So by using something like this, it should be immediately apparent to the consumer that this product contains plastic. And thinking more broadly, and something that I'm guilty of in this presentation, is perhaps that we need to stop calling them filters entirely. I mean, the term filters is a misnomer because they actually don't filter out any of the toxicants and carcinogens. It is an industry term that they've come up with. So I guess we have to consider as researchers and policymakers and clinicians whether we should even be using the term filter in the first place. Calling them cigarette butts or ends might be more appropriate, but this would kind of require widespread and cultural changes. So misperceptions aren't the only barriers to implementation. We don't actually have any real-world data on the consequences of a filter ban, although we can look at Santa Cruz and what happens there for more information about this. However, based on what we do know about filters, is that they increase appeal, palatability, health risks, they're bad for the environment. So we would expect that banning filters would reduce cigarette consumption and benefit public health as well as the environment. The industry are also incredibly innovative, so we need to be conscious about their tactics. So when menthol was banned in cigarettes, there was a proliferation of menthol accessories, so like flavor cards, and you can still get the filters with the crush balls like separate. So we need to make sure that the industry don't come up with other filters of some kind. So policies need to be really comprehensive. They need to cover all combusted tobacco products, so things like cigarillos, cigars, and all accessories that could be added potentially to cigarettes as well. And there are some discussions about banning plastic filters, but allowing biodegradable filters. But this isn't necessarily going to be a good solution. So they're still harmful to the environment because they still will contain all of the chemicals that people that are produced during the combustion of cigarettes. They also maintain the deception that cigarettes filters are beneficial for health because they still exist. And it could be used by the industry as a greenwashing tactic. So we need to be really careful when we're thinking about biodegradable filters. And yeah, the preferable option would be to have a comprehensive ban that covers all filters. And that's it in terms of my presentation, but I'm happy to answer any questions that you have, and the take-home messages or kind of conclusions are up here.